The next talk will be given by Kyle Perry. Gastric ischemic conditioning releases neovascularization and reduces inflammation and fibrosis during gastroesophageal anastomotic healing. So Kyle and his group, Scott Melvin and others from Ohio State. Very happy to hear what you have.
Thank you. All right. I'd like to thank SAGES for the opportunity to present, also for funding this study. This was done on a SAGES grant, and without that, I wouldn't have been able to do it. I don't have anything to disclose. So esophageal cancer is the fastest growing solid malignancy currently, and esophageal resection with gastric pull-up reconstruction remains the most common method of treatment and reconstruction after this, and is associated with high complication rates, especially anastomotic complications of anastomotic stricture and leak, which are related to ischemic problems at the tip of the gastric conduit. So gastric ischemic conditioning by vascular devascularization of the stomach and then delayed reconstruction has been shown in animals to improve blood flow at the anastomosis and improve anastomotic healing. This has been done in human studies too, but the animal studies usually use long delay periods of around 30 days, whereas the human trials have been 4 and 7 days and have failed to show quite as dramatic a difference in leak and stricture rates as we might have hoped. However, now it's really unclear what the time frame is that's required for the delay to work in the best way. So that's what we were trying to look at in this study. So the hypothesis was that a longer ischemic conditioning period between the devascularization and the reconstruction would lead to improved healing at the gastroesophageal anastomosis. So we tested this study in an animal model and a controlled study using opossums. So the reason for choosing possums is because they have very similar esophagogastric vascular anatomy and physiology to humans, and they also have a long intra-abdominal esophagus, so this can all be done transabdominally. So we took the animals and split them up into 4 groups. The first group had an immediate, they were just basically distal esophagectomy, proximal gastrectomy, and reanastomosis. The other 3 groups underwent first an exploration, gastric devascularization, and then an accommodation period of 7, 30, or 90 days, followed by subsequent relaparotomy, resection, and anastomosis. Our initial power analysis called for 7 animals in each arm. We ended up with a few less animals in the longer delay groups. These animals died either during their, before they ever had any procedures done, or we had a few animals die on induction of anesthesia for their first operation. These animals can't be bred in captivity, they're wild caught, and it was just kind of bad luck, I think, that they ended up not so evenly distributed. So then all animals, 10 days after the resection, underwent a necropsy and tissue collection. The endpoints that we utilized, at the time of necropsy, the esophagus and stomach were resected, the anastomoses were inspected for evidence of anastomotic leak, and bursting pressures were tested, and then specimens were collected for histology to look at quantitative microvessel counts and neovascularization, and then semi-quantitative assessment of collagen deposition and tissue inflammation. Those studies were all done by a experienced gastrointestinal pathologist who was blinded to the groups. So our results, 24 animals made it through the protocol and completed all the way through. We didn't have any animals that died once they got the first devascularization operation. The one animal in the immediate reconstruction group developed significant necrosis of the anterior gastric wall and developed sepsis from that, and it was underwent an early necropsy. 5 other animals developed small subclinical anastomotic leaks that were only identified at the time of necropsy. 3 of these occurred in the immediate reconstruction group, 1 in the 7-day delay group, and 1 in the 30-day delay group. And then the anastomotic bursting pressures were not significantly different between all of the groups. Looking at inflammation and fibrosis, the early animals showed a lot of inflammation at the level of the anastomosis. When the delay is done 7 days, we saw less and even less inflammation at 30 days. And we see similarly collagen deposition in the anastomosis was low in the immediate reconstruction group and significantly higher in both the 7-day delay and the 30-day delay group in this case. Interestingly, that at the 90-day time point, it looked very similar in terms of collagen deposition to the immediate reconstruction group. Finally, that histology and microvessel counts, we found that at 7 days, there really wasn't a significant increase in neovascularization that was occurring at the level of the anastomosis, but after 30 days, there was a significant increase in microvessel counts, and then at 90 days, it was actually less, but certainly at least returned to normal levels. I think the conclusions we draw from this are that we see significant reductions in the inflammation at the anastomosis and in microvessel counts and neovascularization after the delay, and these effects seem to be stronger at 30 days than they are at 7 days. And maybe give some consideration to considering longer delay times in human studies. I think the weaknesses in this study did not have a good way to measure and quantitate blood flow in the animals, and so it would be nice to be able to correlate directly the histologic results we see with blood flow and also with tissue oxygen tension and levels. I think in future directions, we should think about applying this to humans, and this has been done, but consideration for longer delay times is probably a consideration. Also, thoughts about which vessels need to be divided still remains unclear. We divided the left gastric and short gastric, so did a complete devascularization. In the clinical realm, this can make coming back to do the left gastric and celiac node dissection difficult. So whether just doing the short gastric vessels will condition conduits is worth certainly looking at. And also how the use of neoadjuvant chemoradiotherapy affects the wound healing hasn't really been studied, and whether these changes will be the same in that kind of environment is really unclear. Thank you.
Any questions?
Kyle, I have a question. I think the reason that people pick 7 days is absence of adhesions, so that you can just go through the chest and pull the graft up. Did you look at the adhesions around the devascularization site?
We didn't look at that specifically. There were significant adhesions there at the anastomosis. When we went back just to do, I didn't quantify it, but we did not have problems when I went back to do the resections, whether it be 7 days or 30 days. There really were very few adhesions there. I think from our experience doing this in humans, we did some when I was in Oregon, where we had taken the left gastric artery, stapled it, come back 2-3 weeks later, and it can be kind of difficult to get back into the right space there, and it impairs the dissection a little bit. But as far as the greater curve mobilization, I don't think any of us have ever seen too much trouble with that.
And did you notice the other problem with ischemic healing, of course, is strictures? Did you look at the stricture formation, especially those with the micro abscesses?
It was such a short time point after. I think that to try to look at strictures, we would probably have to have a group of animals and survive them longer and try to see if they subsequently develop strictures or not.
What do you think happened in your group 4, the 90-day ones that came back?
They're sort of strange. Yeah, some of the numbers are sort of strange. I think that the microvessel counts are low because the stomach is completely conditioned and it's gone back to normal, and you just don't see that neovascularization anymore. The fibrosis, why the collagen deposition was so low in that group, I have no idea.
And they were all that way?
What's that?
All of the animals that survived 90 days.
Yeah, there were only 4, so I don't know if perhaps it was partly just an outlier, or either that or I couldn't. I spent some time yesterday trying to figure that out, and I don't know.
Other questions? Thank you.
All right, thanks.